Hi, good afternoon. My name is Dr. Gandhi. I'm one of the oncologists and hematologists here at Virginia Cancer Center, or Virginia Cancer Specialists. Today, we wanted to talk to you about cancer care in context of the COVID-19 viral pandemic and what our practice is doing to ensure the safety of patients and their family. So, I think we all recognize that even in the best of times, when everything is going well, a diagnosis of cancer can certainly be unnerving and reorient a lot of elements of your life, both for the patient first and foremost, and then of course the family. I think right now, all the anxiety that's associated with the diagnosis is compounded further with a healthcare crisis as significant as COVID-19. And so this is not lost upon us, and we're cognizant of what it means to be dealing with both cancer along with the risks of the viral pandemic. One of the main things we want to reassure patients is that you're not alone in this. It can be hard given the somewhat isolating nature of social distancing and hearing everything on the news while dealing with your other healthcare issues, but our physicians, nurses, and staff are very willing and available to help kind of navigate you through whatever issues that you may have as you deal with the cancer journey. At VCS, we've done a lot of things to prepare and be as nimble as we can to respond to the shifting winds that have been introduced by COVID-19. We have a dedicated task force that's composed of our physician and nursing leadership that meets regularly. We survey and critically appraise the guidelines that have been put out by local and national and international public health authorities to try to intelligently implement them into our practice. Furthermore, we make sure that all the staff is continuously abreast of what the guidelines are, so we are implementing them uniformly throughout, making sure that the patient experience is safe as possible. So this includes several things. First and foremost, we do pre-screening calls to the patients to make sure that there aren't any symptoms that may have been triggered by any exposure, and then navigate them appropriately. All staff members, physicians, nurses, everyone is mandated to wear face masks in the office at all times, and we ask our patients to do this as well. We have temperature checks for patients and all staff members. We engage in strict hand hygiene and hand washing strategies for everyone. We also incorporate deep cleaning throughout the office, so for both exam rooms and in the infusion suites. And through all of these sort of behavior changes, we hope that we're keeping patients as safe as possible and minimizing any risk of COVID exposure while they're able to continue their cancer-related and blood disease-related therapy. So fortunately, we've had very willing partners in our patients and our families, and we are really thankful for that. They've really taken up the mantra of trying to maintain an environment of health for both themselves, their family members, and of course, all the providers. And so they've done a great job in following the rules, and as such, we're able to continue to be fully operational in this time. Equally important, we've now have a fully operationalized telemedicine clinic. So you should be able to meet your providers online through a video conferencing app, which has worked seamlessly. And so now we're able to see patients and assess them through video conferencing and review any of their diagnostic studies pretty easily as well. And our staff is very willing to make sure that we can set this up and execute it without much of a problem. So I think as a practice, what we've tried to do is ensure that we're staying on top of data that is rapidly evolving, both from the clinical realm in terms of what the virus is, the clinical manifestations of it, and then along with that, how to employ intelligent practices to minimize exposure risk for all of our patients. One of the questions that comes up is, should we delay or postpone any therapy during this? These are often hard to answer in terms of an all-encompassing policy. As patients are aware, cancer is a very heterogeneous disease. Different patients have different variations of cancer. There is hundreds of permutations of just breast cancer alone, for example. And so what we try to do is tailor a strategy of therapy that's in line with where the patient is in terms of their cancer health, the nature and intensity of their therapy, and balancing the safety issues imposed by COVID in context of their cancer health as well. For example, there are malignancies that are very indolent or low grade, and it's very reasonable to just observe, or there may be low intensity oral therapies that either can be suspended or continued without negatively impacting someone's cancer health. Conversely, there are other diseases that we feel that any cessation of therapy might be problematic, and so there may be an imperative to continue treatment, but doing it in as safe a way as possible, minimizing the patient's chance of contracting the virus as well. So your oncologist will be able to communicate with you openly and honestly, let you know the risks and benefits of all these strategies, and really come up with a plan that's individualized to you. Similarly to that, one of the other questions we often get, what about preventative care when it comes to cancer screening and surveillance imaging? That's been somewhat more made challenging in the last few months because of a lot of the pivot towards COVID treatment and testing that a lot of the local hospital partners have taken. Right now, that's as the country, state, and community loosens up some of the social distancing restrictions, we are beginning to re-engage with things like mammograms, things like pap smears, colonoscopies. So slowly those services will become more available, and we would encourage you to contact the services, or rather the provider that's performing them, and they'll be able to give you guidance as to how and when they can time those out. Certainly what we don't want to do is miss an opportunity to identify a disease when it's in a very early place or state that we can intervene on successfully. And so screening is a cornerstone of how we treat in oncology. And I think as the world starts evolving and as we kind of move away from the intense social distancing and restrictions that we've had, we'll be able to employ these strategies a bit more as well. That dovetails into how we manage this disease short-term, long-term, and what the effect of COVID is in terms of cancer therapy, and what the effect of therapy is in terms of contracting COVID. So in general, we don't expect changes in the short term to have an impact on the long-term prognosis. And this is something your oncologist will be able to talk to you about in detail. But we expect that by carefully tailoring a plan, whether it be delaying follow-up, temporarily postponing therapy, or modifying therapy, it would be done in context of someone's long-term health, because we very much recognize that this is not a short-term issue in terms of their people's cancer health. So while the data still needs to be read out, and we're going to look back in several years and do these analyses, the general expectation is that what we do now should not impact someone's long-term cancer health. That tails into other questions that we get. Well, how does my cancer therapy affect my risk of getting COVID-19? So the general assessment and suspicion is that the risk of contracting the virus is more dependent on behaviors independent of someone's malignancy. And so that has to do with things like just human interaction, and practices such as social distancing, which are, if effectively employed, can limit that. So in terms of how you're going to contract it, the presence or absence of a malignancy may not necessarily increase that risk. having a malignancy or being on therapy may impact the severity of the illness. Fortunately, what we've seen is the vast majority of patients with COVID-19 recover quickly and successfully. And as I alluded to before, the spectrum of disease is broad, the spectrum in terms of cancer, and the spectrum of therapy is broad. So different patients in various stages of disease or various stages of therapy may have different impact should they contract the virus in the first place. So it goes back to what we're trying to do, which is minimize exposure risk at the get-go. But we are available at all times and work with the local hospitals and any of the other doctors should our patients get hospitalized so that we can provide expertise and counsel in terms of minimizing any impact our therapy would have and to expedite recovery. We've found, and what the data that's emerging corroborates, that it's really coexisting or underlying comorbidities such as things like heart disease, lung disease, diabetes, and certainly age seem to me the main risk factors in terms of people who, when they get the disease, might have some of the more severe manifestations. But by no means is that imminent. And so there is still expectation that should our patients get it, we can still successfully navigate them through that. As we kind of go forward, a lot of the changes that have been imparted by COVID probably are going to be here for the long term. It's certainly impacted a lot of elements of our healthcare. I think the most obvious is the implementation of telemedicine. So patients ask, well, I'm able to do this now. I really like it. Will I be able to do this even after the pandemic kind of fades away? And we really expect that that's going to be a critical component of how we practice medicine, and we expect that we'll continue to use and operationalize telemedicine extensively in the practice. I think both for patients and physicians, it affords this element of ease while maintaining that physician-patient rapport that fortunately we've been able to do. So a lot of things that COVID has done, it's been done at an unprecedented level. There's been no, at least in recent memory, anything that we could use as a guidepost. And so it's kind of put a stress on, obviously, our local community and our country, both in an economic way, healthcare way, and then within our social fabric, because it's impacted our ability to interact with the people we care about. But, you know, increasingly we feel the backbone of this recovery is going to be the strength of our community, the strength of our relationships with each other. And within our practice, we are working really diligently to make sure that you can get the best and safest care possible as we kind of navigate through this. And we've learned lessons very quickly along the way. And as we evolve, we're continuing to mature as a disease. Related issues surrounding COVID and cancer evolve to make sure we're able to do a good job for our patients, keep them safe, and keep them healthy from the cancer standpoint. So we really want to thank all of our patients and their family members for being willing participants and engaged in helping us navigating through this. It really is on the strength of that relationship that we've been able to hopefully been able to provide the care that our patients rightly demand and have come to expect from us. And so we extend a lot of gratitude to our patients and their family members, and so we want to thank you for that.